Welcome to Voices in Nursing with Dr. Nuzil, Care, Policy, and Leadership, the podcast that elevates the voices shaping healthcare at every level, from the bedside to the boardroom, from the boardroom to the ballot box. Today's conversations could not be more timely at a moment where nursing status as a profession is being questioned at the highest level of government. My guests bring a perspective we don't often hear enough, the voices of the family. She recently stood at her husband's bedside through his hospitalization and his discharge, and she watches hour by hour what a professional nursing look like. But she brings more than a family member gratitude. She's a recently retired educator with a distinguished career in Gwinnett County Public School, a former elected official, and a leader preparing to step back into public service. She understands what it means to belong to a profession that is essentially yet undervalued. She understands how policy shapes the people who care for us. Please join me in welcoming her to Voices in Nursing with Dr. Nozil, former Councilwoman Marlene Taylor Crawford. Welcome.
Thank you so much, Dr. Nozell, for having me here today. I really appreciate it. And to all the listeners, thank you for tuning in. Thank you.
Well, Mrs. Crawford, tell me a little bit about you. I know I just tell about a hint of what you're doing. Tell us about yourself.
Well, thank you so much for your question. I guess the best way to surmise who I am, I have such a great opportunity throughout my life to merge my two loves, education and community service. Okay. So as you stated before, I'm recently retired as a school counselor. Most of my 35 years in education was served as a school counselor, but also as a teacher. I worked on the elementary and the high school levels. And then also I had an opportunity, and I will continue to serve in other capacities as an elected official for the city of Lawrenceville. So that will continue to be my love, serving in politics. But I have so many years of service helping the community in so many different ways. And I'm so honored to receive many awards, accolades for my service. But most of all, the love that I have for people has really driven me to continue to do the work that I have started many, many years ago. This was instilled in me as a child. Both of my parents were immigrants to this country, so everything was education and service. Mm-hmm. So I grew up with that instilled in me, and I continue to see that as my way to continue in my life. I guess that's the easiest way to say it. I know no other way but to educate and to serve.
That's a calling too.
Yes,
education
absolutely,
and service.
Absolutely.
Education's always service.
And I do want to mention I am a wife, I'm a mother, and I'm a grandmother. And I have instilled all of my passions into my children and my grandchildren.
Well, that is so wonderful. But take us back to the moment your husband was admitted at the hospital. What do you remember feeling into those hours, the first hour, and what was the first nurse you?
So if I can go back to that Saturday morning at my home, it was very scary. Mm-hmm. It was put it like this. I guess the best way to put it, if I did not have the faith that I have in God, both of us, we would not be able to really focus and understand that in spite of everything that was happening, God was still in control, caring for him, taking care of him. So that's when we really had to lean into our faith and not let fear overcome what was going on, because he had a very, very, very serious medical emergency the ambulance had to come to the house. We were rushed to the hospital. So the first nurses that we encountered was in the emergency room.
Great. You had a great experience there.
We did. Well, the best way to put it, we were shown compassion. The nurses took the time to explain what was going on before the doctors came in the room. So we had a chance to calm down, I guess, if we could, and kind of stay focused to say, okay, this is what, to understand what is going on. The nurses stood by our side and helped us. And matter of fact, when we left the emergency room to go into a room, and my husband was in the hospital for 3 weeks. Then after that, he went into 2 rehabs. So he was out of the home because of the medical emergency for 4 months.
Yeah, that's the main thing. They were able to calm you down, because that can be panicking when your loved one having an emergency and you feel like you don't know what to do.
Exactly. And they answered questions, the nurses.
Yeah.
They went above and beyond, because it wasn't just, okay, we were not just a number coming in there like next. They took this time to show what I call the human side of leadership. And leadership in nursing and education, whatever capacity, is extremely important, because you're not just looking at someone as their sickness, but as a human being.
Yes.
And taking the time to ask them how are you feeling, let them know what's going on, what's going to happen next, because all of that helps to lessen the anxiety and to also enable you to think more clearly. And that helped me tremendously. Of course, my husband as well.
As a wife at the bedside, what did the nurse do beyond the medicals and told you your husband was in a professional hands?
So that goes back to the human side.
Okay.
Yes, just being there, showing compassion, asking him, are you okay? What do you need? And even joking and kind of, saying some funny things and letting him know you're going to be okay. It's okay. And asking him, what did you do? Getting to know him more. What was his career like? What did he do? Just building a relationship and not just focusing on the medical part, but looking at the whole person. I call it a holistic. Yes, holistic approach. His mental, spiritual, emotional state of mind, and of course physical, but making sure all those aspects of who he is as a person was definitely being addressed.
When you come to Gwinnett County, what attracted you to the educations?
So it was just to continue, because prior to coming to Gwinnett County, I worked in the New York City school system for 9 years. So I just continued what I was doing in New York City. So I've always had a passion to serve in education, working with children and families. So for me, it was just a natural transition for me to continue that service. And I would say one of the driving forces within me is compassion.
Okay.
You have to have compassion in order to do the work that I do, whether it's in education or in community service, because if you don't care, this is not the right field for you, just like in nursing.
And healthcare.
And it's a calling, and I believe the calling comes from God, and just to walk in the path that He wants you to walk in, live your calling, and of course have the passion to help others and to make a difference. I always say I have no excuses. So many people have done so many things before me, people whose names I don't know, I can't even call, but they made it possible for me to be who I am. So I have no excuses. I will continue to serve and help others. And I thank God for the nurses who have the passion and the commitment to serve in spite of all the struggles, because I know that it's not easy, but I have only great things and all the honor and respect for nurses.
Yes. And then as a nurse myself, I can thank you for being open up to show your gratitude about nursing. And then as we know in the hospital, we have other specialty area beside nursing. Any other interactions you have with other healthcare workers in the hospital?
Yeah, so my husband was at Northside Hospital, Gwinnett, and from there he went to Glancy Rehabilitation Center, which is a part of Northside Hospital. And then after that, he went to Life Care Center of Lawrenceville. Within these three facilities, not only were there nurses, there were doctors, CNAs,
Yes.
and also the occupational, physical, and speech therapists,
Yes.
and also the social workers.
Yeah.
So we had an opportunity to interact with everyone, the whole team. So everyone was extremely supportive,
Wow.
and
Nice.
they really helped us to navigate so many things. And I tell people, you don't understand how complicated the medical system is until you're actually in that position where you have to navigate insurance,
Yes.
different types of doctors, and what's going to happen after discharge, the at-home care that is needed. It's very complicated, and if you do not have trained professionals who are compassionate to help you and guide you through that process, it can be very overwhelming, and you can make some errors that can really be a serious problem. So I'm so thankful that we had all the support that was needed to carry us through everything that needed to be accomplished.
Yeah, well, that's a big shout out to Northside Hospital.
Yes, absolutely.
Because you had a great
Definitely.
experience, and then with the whole team, the whole
team,
team, I was there.
the neurologist as well. And I'm just so thankful when doctors understand that they cannot do this work without God. And one of our neurologists contacted me, and she said, asked me rather, does your family pray? And I said, yes, we do. She said, now is the time to pray.
Yeah.
So when I know that we have gifted hands by the Father God who are helping with our loved ones, that makes such a difference for me.
Yes.
So I'm very thankful. And I have learned so much more about different types of therapy. You know, you hear about physical, speech
therapy,
occupational, but you really don't realize how critical those disciplines are until you're actually in a position where you can see up close and personal the work that they do.
Yes.
So everyone plays a major role in the CNAs. I want to thank them so much. My husband has built such a strong relationship with the doctors, the nurses, and the CNAs. Nurses came back a few times to visit him at home.
Wow.
And the therapist came over as well. So we have an extended family now, and we're just so thankful for
that is so nice to hear.
Oh yes,
that is so nice, because a lot of people don't know how helpful those healthcare workers are doing.
Now, growing up as a child, my mom was a nursing assistant. I guess now they call it CNA.
Yes.
During that time. And I would see her, put on her uniform, go to work, definitely appreciated everything that she was doing. But now I see it on a whole nother level, that I thank God for all the medical professionals, and thank God for the nurses who were there each and every day helping us.
Yes. And then that is a great testimonial about your experience with your husband, and also help our listeners to understand that in the healthcare, there are a lot of works, and we works a lot, and there's a lot of going on just
definitely.
Obese, be laying on the hospital bed,
Yes, exactly. So I do want to encourage anyone who's going through an experience that they have to go to the hospital, rehab center, whatever type of medical facility, to also advocate for yourself as well, because when you go in there and you speak up and you ask for things and you ask questions, that makes even a stronger impact. Although the nurses are very compassionate, the doctors and listening, you also have to have a voice too, to make sure that you're staying on top of your own care or the care of your loved one.
That's right.
Take notes, come back and ask questions for clarifying questions if you need further assistance. But don't go in there just like, okay, just leaving everything up to everyone else and not have a big part in your loved one's recovery.
That is a great point. And then from asking questions, you learn more.
Absolutely.
If you don't ask, you don't know. And if you assume, you might make mistake or assume wrong. So it's always good to take notes.
So when I would come into the hospital or the rehabilitation centers, everyone knew me, you know, who dealt directly with my husband, because I was always there. So being present is very important as well.
Yes.
And just showing respect, because it was never a confrontational type of interaction. It was always what's going on. What can I do to help? So everyone plays a part in the healing of a person.
Yes. So let me ask you a question. As a former elected official, you have sat in the room where decisions get made. Where nurses' voice present in those rooms?
Well, that's a really good question, because serving, when I served in the city of Lawrenceville, Northside Gwinnett Hospital is in the city limits of Lawrenceville. So we always had an opportunity, not always, but often had an opportunity to hear from some of the leaders at the hospital. But one thing I must strongly advocate for: in each community, there has to be a strong healthcare presence in the community. That whether it's a doctor's office, some type of medical practice, whether doctor's office, rehab center, testing facility, hospital, because when families have to travel very far for medical help, that's definitely difficult, and that creates a barrier for people, loved ones coming to visit, really advocating as strongly when they have to travel a distance. So I think each community needs to have an established medical system or some type of facility, if not a whole hospital. I think that's really important. And also insurance.
Yes.
I'm so thankful that we did not have to go through difficulty navigating the insurance and being denied and not having insurance, because I saw that too. Because during my husband's care in the hospital, the rehab facilities, everything is, we got to check with the insurance, make sure it will pay for this. So each step of the way, insurance is involved. And if we do not stand strongly to advocate for Medicaid expansion, and especially our children being insured, it is going to cause such a hardship.
It will.
Yes, and I'm saying that, I mean, in so many different ways. So
yeah, policy and politics, our healthcare people, the higher level of the government, who's making decisions about healthcare, don't know about healthcare. And we have people that is on healthcare, not interested or not voting or not participating on in voting or in policies. So now, what would you say to a nurse or to anyone that is on healthcare who believe that voting or policy or politics is not their job, is not what they need to get involved in? Would you say?
Well, I would say that is not true at all. Nurses have to be strong advocates. I think that's really important, because in order to see change and to ensure that your voices are heard, and this is across the board, people have to speak up and speak out.
Yes.
And that means that voting is extremely important. And I understand nurses work long hours, but there's early voting, there's absentee voting. So there's many different ways to vote, and also attending council meetings, commission meetings, going to the state capitol, advocating in that way, and educating patients and letting them know when people are complaining, oh, why is it taking so long for you to come to my room? Why is this happening? Let them nurses can let them understand by educating patients and their families what is happening, what are some of the barriers for your care, what's going on in terms of insurance and not having enough nurses.
Yes.
I saw a lot, and during one of the times, one of the CNAs, she went on break. There was one nurse that was available. This was not at the hospital, this is at one of the rehabs. And he told me, well, the CNA is on break now. I said, well, everything can just stop. I mean, someone still has to be able to care for the patients. And then I realized, wait a minute, there's such a shortage here.
We do.
Yes, and it's not because the person does not want to do his or her best, but because they don't have the capacity when there's not enough people available. So I think that nurses have to strongly advocate for their profession and get people like myself to help advocate for you, because definitely you can't do it all by yourself. And no one can tell me that they don't know a person who has not been touched by a nurse at some point in their life.
Yes.
Just like I tell people with educators, but with nurses, all of us know someone, including ourselves, that have been touched by a nurse.
That's right, yeah. And then in a couple of episodes before, I had someone who call me and tell me, we already have a shortage, mind you, we already have a shortage in nursing. Tell me, well, since nursing is not a profession anymore, so should I go to nursing school? So
let me tell you something. Amount of medication that my husband had to take in the hospital, the rehab, the 2 rehab centers, and now at home. I think that's an insult for someone to say nursing is not a profession. They're dispensing medication. Now, do I want someone who does not have a professional career and understand medication?
It's a life of death, yeah.
To dispense medication?
Yeah,
administer medication, glucose testing.
Yes.
And listening to some of the...
it seems like you're already a nurse.
I mean,
you know, to give a blood pressure medication, you have to see what
yes,
blood pressure is.
That's such an insult to say something like that.
Yeah. And then to give insulin, to give diabetic. You see you're already learning to, I'm gonna put you on the bedside.
Absolutely. So when I was being taught how to prick my husband's finger, I said, oh my gosh, I would fail. I would get an F. And the nurses were like, oh no, it's just 1, 2, 3. And I'm like, okay.
Yeah.
So
you get the teaching, you get the learning.
Absolutely. Yeah. But it's definitely a profession that we need to honor and we need to respect.
Respect, that's right.
And embrace and understand. If there were no nurses in the hospital right now, what would happen?
And I was thinking, let's say if nursing is not a profession, let's have nursing take 1 day not working.
Exactly.
And then someone tell me 1 day we need 30 minutes. If you're
please, let's not let it come to that.
No, it would not.
No, happen. And I'm just thinking about during COVID, all the nurses who risked their lives, the healthcare professionals. So not only are you caring for people, you're also putting yourself at risk in so many different ways.
Yes, you are correct. But we are working, navigating to that. And then I am glad to have someone like you to come in and help other future nursing who are interested in nursing school to go.
Definitely, and I will encourage so many young people, especially high school students, who are unclear about what they want to do to consider nursing, have an opportunity to intern, if at all possible, at a healthcare facility to really get a better understanding of nursing. And I just learned there's so many different types of nurses as well.
Yes, there
And
are.
nurses can travel all throughout the country.
Yes, yes.
Yeah, so they work in different facilities. So it's not just like working in the hospital, which is great, but also it's so many more
Yes.
avenues that you can
There's
navigate.
education,
Yes,
you can teach.
exactly.
You can be in a community. And there's a nurse anesthetic, there are licensed practical nurses doing physical for employee health.
I noticed more men that's in nursing. So when I was growing up, you think of a nurse, you know, this is old time.
Oh, no.
Just as men are nurses, and then also very multicultural.
Yes.
So we had an opportunity to meet nurses who come from many different countries, and we had great conversations.
Yes.
And they spoke several different languages, so they're able to communicate with even more patients because the language barrier is not as difficult as it was in years past. So it's so great in different age groups.
That's right.
Yeah,
that's
so
right.
nurses who have been
the age doesn't matter.
That's right.
And your cultural doesn't matter. You name it.
It is a great profession.
I love it. And I was doing my nursing career. I told you I was a consultant. You can work with attorneys.
Isn't that something?
On malpractice or for insurance company. So I enjoyed every bit of it.
Yes. And thank you so much.
In closing, what do you want families to know about speaking up for the nurses who care for their loved one?
I want families to know that you should really understand the work of a nurse. And in order to do that, have a conversation with someone who interacted with a nurse. It might be you, your family members, a friend, and just think about something that Dr. Nozell said earlier. Suppose that there were a day without a nurse, or 30 minutes without a nurse. What would that look like? And just really appreciate the fact that there's someone who wants to care and have the best for your loved one during one of the hardest and difficult time of your life. And I can speak for myself, definitely, and for my husband. What we went through, we could not have really gone through it without, of course, first without God and without the caring arms, hands, mouth, heart of a nurse. So educate yourself on nurses, have a conversation with a nurse, and really get to understand what nurses do because it's invaluable. You cannot put a price on the work that a nurse does because that's like me saying I put a price on my husband's life. No, it's invaluable. So thank you so much, all the nurses. Please know that you have a strong advocate here. I wish I was a billionaire because I would go around take care of all of you. But you know what? Even though I can't do that, I will be a strong advocate because the work you do is something that we must honor, respect, and know that we cannot do without nurses.
Thank you. Tell us what your next steps in the political arena.
So my next steps are, and of course, before I do anything, I go to God in prayer to make sure my steps are being ordered. So that's very important. And of course, I speak with my family. But anyone who knows me that knows that I'm not a person that sits down. I have to stay busy. And I always say right now, God had to reposition me to make sure that I was there for my husband. But as he recovers well, I'm going to definitely have those conversations about running again for office. I'm not too sure what capacity, but my heart is always in service and no one can silence my voice.
Wow. What a powerful conversation. Today, we heard something the data can't capture, the testimony of a wife who watched professional nursing saves, comfort, and restore her husband, told by a woman who has spent her life in education, in public service, and knows exactly what a profession looks like. To every listener, when anyone questions whether a nurse is a profession, remember this episode. The public knows the truth, families know the truth, and as my guest reminded us, the truth belongs in policy, which means nursing voices belong in every room where decisions are made. Thank you to my guest for her testimony, her service, her advocacy, and we wish her well on her steps back into the arena of policy. For my listener, keep caring, keep leading, and keep using your voice. This has been Voices in Nursing with Dr. Nozil, Care, Policy, and Leadership. Until next time.